Hey, it's Dr. Spears here, and I want to share some news that you probably already heard now, but if you haven't heard, in the last 2 days or so, there have been some significant changes to one of the medical licensing exams, USMLE Step 1. The people who make that test, they decided that they were going to make some changes. And the biggest change is that this test used to be scored. So you get a score, a 3-digit score. And now they decided that the test, the USMLE Step 1, will now become a pass-fail exam. And this will take place in the next 12 to 24 months. They're expecting it when the change would not take place anytime before January 1st of 2022. So this is huge news for anybody in the medical community, especially those who are trying to land a residency position. And here's what usually happens. You go to medical school, you get in, you're excited, you're going to be a doctor, you're on your way. However, you need to do all your classwork, and then you got to take these things called these board exams. And the reason that boards matter is it's the number one factor that residency programs use when they decide who they're going to invite for an interview. And why do people care about boards? Why do people care about residencies? Because you need to do a residency to become a licensed physician. And also, not only for the residency, but depending on your board score, it means whether you can get into certain medical specialties, because your super competitive specialties like plastic surgery, dermatology, orthopedic surgery, and even let's add radiology and stuff like that, those are super competitive. So the applicants who get into those, they're actually going to have very high board scores. And now, when they're going to pass fail, that just totally changes the game for everybody. Because I remember when I was in medical school getting ready for our board exams, which you take after your second year of medical school because it covers all the basic sciences, people would actually debate whether they were going to come to lecture or whether they were going to skip lectures to go and study for their boards, because they knew that the boards meant more to them than doing like getting top grades on their medical school classes. So that's what would happen. But with this change now, you don't have that incentive to do like super well in your boards, because nobody's going to know whether you got a high score or low score. It's going to be whether you passed or failed or not. And so people are going to just basically do enough to ensure that they earn a passing score on their USMLE Step 1 board exam. And this means that residency programs, they're going to need a different way to evaluate who they're going to invite for an interview for residency programs and who they're going to select. And what my thought of what's going to happen is that instead of looking at your step 1 board scores, which are based on the basic sciences, you still have to take your step 2 boards for a lot of programs. And now they're going to put a lot more emphasis on how you do on your step 2. Now, this can cut one of two ways. Some people would say that's not a big deal because your step 2 scores, that's actually like clinical medicine. That's like the actual practice of medicine. And so it's a lot more relevant to what you actually do as a physician throughout your career. So I don't think that's like a huge thing. I just think now that medical students applying to residency, the focus and the shift of things is going to just shift over to step 2. Because here's the thing. You have more people applying to residency programs than they can admit and everything like that, just as the same thing with people applying to medical school. And so the residency programs, they're going to need a way to screen who they're going to admit, who they're going to actually invite for an interview. And the easiest way to do that is you need something that's standardized. So you're going to have those numbers. So now that step 1's pass fail, you can't use that, but you're still going to have your step 2. So now that's what everybody's going to focus on. The shift is going to be on step 2 to decide who you're going to admit, especially for those super competitive residents I talked about, plastic surgery, orthopedics, dermatology, anesthesiology, ophthalmology. Those are the ones that are really going to start screening on those. And so I don't think too much is changing. However, I've heard, I'm speaking to people in this process because nothing's set in stone. Nobody knows what residency programs are going to do, who have varying opinions on this, where some are extremely upset and they think that this doesn't, that actually makes it disadvantageous to people who come from underprivileged backgrounds, or they're foreign or international medical graduates, or they went to a lower tier medical school. Because now, if everybody's pass fail, what do you think is going to happen? If I have somebody who went to Harvard Medical School versus somebody who went to an international medical school, and I can't distinguish anybody based on your step one score, I'm most likely going to take the person who went to a more reputable medical school when I'm selecting people for residency program. So I could see how that could hurt people, and people are just upset with that. And then I also heard somebody say that it takes away the merit from people who go to lower tier medical schools or who are underrepresented minorities in medicine, where maybe they're not at a top tier medical school. There's various reasons why they had to choose a particular medical school to attend. But however, the way that they could level the playing field was actually through their board scores and everything like that. And interesting point is, I was actually talking to a resident currently who's an underrepresented minority in a super competitive specialty, and they are in residency. I forget what year they are, but they put this out there that somebody commented like, "Oh, you're here because of affirmative action," or something like that. And this resident was appalled by this, upset by this, rightfully so, because nobody should be saying that, because they went to like they're at an Ivy League residency, and they were like, "No, actually, I worked my tail off and I got a super top USMLE step one score, and that's why I'm here. That's why I got in, because I worked really hard." And so that's what's going to happen to a lot of applicants then, that they feel that they can't get into programs, or it's going to be tougher because no one's going to see the work that they did with their step one score to give them that advantage, and they feel like that's going to hurt them, especially for people who are international medical graduates, because they really bank on that as a way to like level the playing field. And even underrepresented minorities, lower tier scores, people who went to osteopathic medical schools, it's going to just make it difficult for them, because a lot of the, if now that you don't have your step one score, people are afraid it's going to turn to the good old boys network, where it's going to be, "Oh, I'm Ivy League, so I know somebody at an Ivy League school, Ivy League residency. They can put a word in for me and I can scoot to the top of the line," because it's not like you can say, "Oh, well, we looked at your step one score, and so that's why you're here." Whereas that's just not going to be the case anymore. So people, regardless of how they perform, they can get in based on their connections, and people just have varying points of view about that. And I just feel like we're at where we're at right now, and you have to work within the confines of the system and what's going to be in place. And if you know that, okay, your step one score isn't going to be calculated anymore, or it's going to just be pass fail, you need to do everything else to make yourself a competitive applicant. Maybe you need to schmooze a little bit yourself and do what you need to do to get into those positions, and make sure that you're competitive for medical school. And so I'm looking behind me. The vehicle's not in motion, but I just had some police behind me. I'm in Washington D.C. right now, so that's why I got the suit and tie on. If you guys wonder what's happening, that's why I looked up. I had the men in, what is it, blue behind me, and they're not doing anything with me. They left. So just that's why I was sort of taking a little pause intermission for that. But yeah, going back to this topic, curious to hear what are your thoughts about this for resident selection, where no longer are you going to have to, if you're starting medical school, you're not even going to have to worry about boards really, or at least step one. How do you feel it's going to affect you or other people you know, or if you already went through the process, you're a resident or you're a physician, what's your stance on that USMLE step one is now pass fail? I can see pros and cons of it either way, and I think it's going to really reduce the stress load for a lot of students. It's really going to change how they prepare for those first 2 years of medical school, and it's going to be beneficial long term because you either way, I feel like anybody in medical school, they're going to work hard regardless of that because they want to do well. They want to be a smart, competent physician and all of that, even if it's just pass fail, such as you do your clinical skills. That's actually like doing seeing mock patients. You see about 12 of them, and you have to take a history physical and then write your SOAP note all under time conditions, and that's just pass fail. And I studied like crazy for that, and even though I know it's a pass fail exam, just because I want to do well on these things, and you don't want to have a retake or not pass it the first time, I feel like that's what's still going to happen when it comes to board step one. People are going to really just put in overdrive, study like they need to do because they want to make sure that they pass the first time, and they just want to know that they have a solid knowledge base going into that. So this is Jason with Dr. Premed signing off on that. Curious to see your take and your stance on USMLE step one now being a pass fail exam, no longer scored numerically.